Hi, so my poster was about the barriers to the uptake of immunization, of child immunization within 4 districts. It was a qualitative, in-depth project. You have many factors that influences the barriers to the uptake of immunization, and it was a mixed method approach. It consisted of the qualitative data component was, having to conduct 15 key informant interviews with local health managers, healthcare staff, community members, and also we had about four focus groups within each district. The districts being eThekwini, City of Joburg, OR Tambo, as well as Dr. KK within the Northwest. And the information that we gathered or assessed or that we actually wanted to do obtain was to find out what those barriers are, and also the key informant interviews and the focus group discussions was to get more perspectives from the communities as well as the local health staff with regards to these barriers, as well as methods to or strategies to improve the uptake of immunization, and as well as also a lot of the barriers. And this study was actually done in a rural setting. So a lot of challenges come from whether it be social norms. A lot of the factors are like the religious beliefs around mother's autonomy, or gender equality would bracketize the autonomy of mothers or fathers from a caregiver perspective, as well as other factors that would affect barriers would be the interaction with healthcare staff, between patients and healthcare staff, as well as I mentioned the religious beliefs. There's experiences of healthcare at the facilities. Other barriers are mothers wanting to take their children for immunization for catch-up, and fathers that are not allowing them to go because fathers need some money for their social activities. And hence, these mothers, the love for a mother and a child, she would discreetly go to the facilities while her husband's going to work. And these facilities are actually 8 kilometers away. They start walking 4 o'clock in the morning over mountainous areas and rivers, as they don't receive an income. So for them to walk 2 kilometers to a freeway to get in a taxi up and down costs about 80 rand. They'd rather take these shortcuts, and in winter, shortcuts while walking, some of these people get raped along the way as well. Sad, but their own methods of minimizing that, they would walk in groups. So that was my presentation. So my experience, generally the PHASA every year, it's a good method of networking with you're always crossing paths with previous organizations, partners, funders, and thus far it's always a pleasure, networking with new faces, old networking groups. I had a lot of people asking questions within my presentation that was actually helpful, and some of the questions are actually kind of spin-offs to a next research question pertaining to child immunization, and that are the advantages of these networking conferences like PHASA being one of them. And yes, that for me always is a benefit of attending these conferences, and also listening to other and joining in on other sessions, plenary sessions. Sometimes you gain keen interest on things that would jog your memory for another research question that hasn't been answered. But yes, that's the highlight for me, the networking. My biggest learning point at PHASA so far is I've come to know that never join plenary sessions that you always have a keen interest in on. but rather to open up yourself and be exposed to other projects that kind of give you another sense of how else you could strengthen the health systems. Um, and yes, that for me is the biggest learning point of the PHASA.